VNTV 55.2, chúng tôi là tiến sĩ Diệu Khoa đây ở trên, và chúng tôi cảm ơn quý vị rất là nhiều đã trở lại với chương trình của chúng tôi. Đó là Sức khỏe thưởng thức. Và hôm nay chúng tôi rất là hân hạnh là chúng tôi mời được một vị rất là có thể là đặc biệt cái chương trình hôm nay. Chúng tôi sẽ xin phép trình bày gọi là chiropractic. Kính thưa quý vị, hôm nay chúng tôi là giới thiệu đến quý vị Dr. Renee Lasanta. Dr. Renee Lasanta, would you like to say hello to our Vietnamese audience, as well as we have it looks like you have a patient here / assistant.
Yes.
Yes.
Hi, I'm glad to be here, and I'm here to answer some questions that you have, and I'm happy to be here outside of the rain.
Thank you, Dr. Lasanta. And what is your name? Would you like to say hello?
Hello, I'm Liliana, and I'm the assistant.
Great, thank you. Dr. Lasanta, first, a lot of times our Vietnamese audience, they may have seen an advertisement on the radio or TV, and they hear chiropractic, and they wonder what is chiropractic, because it's a term that they're not accustomed to.
Yes.
So would you like to share with our audience what chiropractic means?
Yes, chiropractic, basically chiropractic is a Greek word that means pertaining to practicing with the hands, and that's what we use. We use our hands to treat patients. This particular healthcare profession it deals with the nerves, the muscles, okay, and the skeleton of the body. So we're specialists in the neuromusculoskeletal system, which encompasses the majority of the body itself. Okay. We do this treatment by diagnosing, and we try to help people to prevent the diseases of this particular system, and we try to treat the patient so that they will have utmost health and to prevent diseases. That's the biggest thing. Okay, we deal with complaints of back pain, neck pain, joint pain in the arms and legs, headaches, but we're not limited to that. We also treat other areas of the body, but that's our majority of what we treat.
I see. Kính thưa quý vị, Dr. Renee Lasanta, ông ta là bác sĩ. Ông ta chia sẻ nói rằng là cái nghề mà nói về chiropractic, cái chuyên môn dính líu về thường thường là đau khớp xương, có thể là đau đau lưng, hay là đau cái phần tay, hay là có thể là dính líu về xương mà trong mình của mình. Nhiều khi bệnh nhân mà nói về nhức đầu nguyên năm gì đó, không biết lý do tại sao, hay là nói là bệnh nhân đó là sao tôi lại đau nhức ở đây, hay là đau một cái phần nào trong cái bộ phận của mình của chúng ta đó, thì Dr. Lasanta chia sẻ là cái nghề mà chúng ta nói về chiropractic là chuyên môn về như vậy. So then, Dr. Lasanta, if you could please share with our audience, what is chiropractor versus a physician? Because you are also a doctor.
Yes.
And if you don't mind, also share with our audience your background, because we know that you are, if you can share that you're an instructor.
Yes, I'll share a little background.
Yes.
I came to chiropractic. I am a United States Army retiree.
Oh.
I spent 23 and a half years in the military, which was my first career.
Oh.
And in the military, I practiced nursing. I was a licensed vocational nurse in the military. When I came out of the military and retired in 1996, I decided that I was going to go back to school. And I wasn't sure which way to go, whether to go the medical doctor, the doctor of osteopathy, or the doctor of chiropractic. And the doctor of chiropractic seemed to be better for me in the fact that I tried to look at the body as a holistic person, as a holistic unit, not just a pain or not just a disease. So that's what I was looking for. So I went into that realm. I did my research and I went into that realm. As far as the differences between chiropractic and medicine, chiropractic we practice a drug-free medication, a drug-free hands-on approach to healthcare. And that includes, we do patient examination, we do diagnosis, and we treat with our hands. Okay, and a lot of people know what we do is we give an adjustment, a chiropractic manipulation treatment. Some people call it popping your back.
Oh,
okay, but
popping.
we don't, or cracking your back. We don't, it's a popping sound from the breakage of the nitrogen capsules in the joint is what you hear when you hear that popping sound. But we don't hurt people. You know, we do the best we can.
Yes.
We're trained in diagnosing, and we're trained in counseling and recommendations for therapeutic and rehabilitative exercises, as well as we provide nutrition, dietary, lifestyle changes, and overall a holistic type of counseling and treatment. So that's on the other hand, medicine, they treat with medicine and surgery. Okay, they also diagnose and things like that. So as far as the comparisons and the differences, we stop at how we approach the patient and how we treat the patient. The physicians, medical doctors, they treat with medicine and surgery, and we treat with hands-on adjustment, nutrition counseling, lifestyle changes, and things like that.
I see. Now, this is just more of a curiosity. You talk about hands.
Hands.
So do most chiropractors have strong hands then?
Yes. Even the small ladies like this, they have real strong hands.
I see.
Yes.
I see.
It doesn't really have to do with the strength of the person. Is learning the techniques.
I see.
Because it is an art. It's like going to school to learn how to paint. You don't just go in there and just dabble. You know, you have to learn how to do the fine lines and stuff. So we spend every semester, every year of our education in chiropractic college we have palpation and we have adjusting. So we go from adjusting 1 through adjusting 9. Okay, so we go through the entire 4 years having adjusting classes and becoming more advanced and more proficient at what we're supposed to be doing.
I see. Wow, that is so interesting. Kính thưa quý vị, bác sĩ Dr. Lasanta chia sẻ là khi mà chúng ta nói về chiropractor hay là chúng ta nói về bác sĩ đó, thì thường chiropractor là chuyên môn về lo lắng cho bệnh nhân để mà trị cho bệnh nhân, không có cần mà thuốc. Tại vì nếu mà thường khi mà chúng ta đau lưng hay là nhức đầu mà chúng ta đến bác sĩ thì bác sĩ thường viết to, còn bác sĩ đây thì là không có viết to, chỉ là chuyên môn mà cũng như trị người bệnh nhân khi mà dính líu về hai cái bàn tay, thì là có thể là dạy giúp cho bệnh nhân cái cách mà ngồi, cách đứng, cách làm sao, hay là cũng như là nói về những cái chất vitamin mà bệnh nhân có phải nên uống, khám cho bệnh nhân, nhưng mà chỉ không có dính líu về viết về to prescription. So then, Dr. Lasanta, can you share with us about the educational certification requirements?
Yes. For chiropractic, just like medicine, we have to go through 4 years of undergraduate.
Yes.
It used to be where we only had to have 60 hours. That has recently changed. And the majority of the chiropractic colleges are requiring a degree, a bachelor's degree,
Yes.
Before you enter, plus there's certain criteria that you have to take for that. We follow the same pre-medical program as the medical schools do. Then we have 4 years of chiropractic college, followed by a year of internship, and then we go into practice. We don't normally do residency. We do have postgraduate programs available to the chiropractor that wants to pursue, such as in neurology, internal medicine, pediatrics, things like that. And we have to pass 4 national boards and 1 state jurisprudence test before we are actually licensed to practice. So it's pretty rigorous. The fourth board that we have to do is actually a practical board, which is hands-on, and it's pretty intense. It's 3 days long, very, very intense. And so we're licensed in all 50 states in the United States and throughout the world.
Wow. So total schooling together is how many?
Say again?
Total schooling together to be a
between 8 and 9 years. Well, between 8 and 9 years. If you want to specialize, it may be between 8 and 11 years.
Oh, wow.
Okay. But you can actually, unlike medical, on the medical side where you go through a residency and then at the end of that residency you apply for the last part of your state board, we do our state boards first and then we go into postgraduate studies.
This makes me appreciate our chiropractic so much more. Yes, I didn't know there's so much schooling.
There's a lot of
That is a
schooling.
lot of schooling.
Yes, a lot of schooling.
That is, yes, definitely. And I think earlier you mentioned too, in regards to the classes or the hours, Doctor of Chiropractors has roughly about 2,400.
Right. Roughly, if you look at the college, you look at classroom hours, okay. So if you look at classroom hours, a chiropractor will be in the classroom setting, 2,419 hours compared to the medical side, which is just 2,047 hours.
Yes.
So in essence, we are in the classroom longer. However, our medical counterparts tend to be hands-on and more in residency than we do. So they have a longer residency, more of a practice after school than we actually have.
Yes.
We only have that 1 year of internship.
I see.
Yeah.
I see. Kính thưa quý vị, thì bác sĩ Dr. Renee LaSanta chia sẻ là khi mà chúng ta nói về chiropractic thì bác sĩ là thường là học từ 8 năm đến 9 năm, 4 năm là học đại học, rồi sau khi học đại học xong thì mới thẳng vô trong trường chiropractic. Thì khi mà vô trong trường chiropractic thì khi mà ra trường phải thi thường là rất nhiều cái boards, là nhiều exam để mà mới ra trường được. Thành ra Diana cảm thấy là nếu mà so sánh giữa bác sĩ Doctor of Medicine, MD với bác sĩ chiropractic thì Doctor of Chiropractic học cũng nhiều lớp lắm. Vâng. So then, can you share with us then, Dr. LaSanta, when does a patient know when he or she is in pain? So, for example. For myself, for example, I have a lot of back pain, and I know a lot of Asian patients, they tend to have knee pain, either shoulder pain, even our dentists, for example, when they have to bend down and treat a patient, they tend to have neck pain too.
Right.
So then when does a patient know that, oh gosh, I need to go and see a physician, or do I go and see a chiropractor?
Well, let me see how I can explain this. Patients with pain, regardless of where the pain is, they really should go to the medical provider that they feel most comfortable with.
I see.
The person that they trust. Okay, because we do not prescribe medicine or do surgery, then if they're looking for medication relief, then they should see a medical doctor.
I see.
If they're looking for holistic relief, or if they're looking for rehab therapeutic or something like that because they had an accident or injury, then in my opinion, they should come see the chiropractor.
I see.
I think we're probably the most trained in that aspect.
Sure. Yes.
And then if we're trained also as chiropractors that if there's something that we can't handle, okay, of course we're going to refer them to the medical professionals so that they can either have the surgery or do the medication route.
Yes. All right.
But I think that's a personal decision for the patient to decide. Okay, my back is hurting. Do I need medication or not? If you don't need medication, then maybe see the chiropractor. And if you're really looking for medication, go see the person that can give you medicine.
Yes. Yes. So then, if let's say if the patient comes and see a chiropractor, are most of the insurance covered by for chiropractic services?
Okay.
Then?
Well, most insurance companies do provide a chiropractic coverage. However, it's very limited.
Oh, limited.
Because we have this conflict sometimes with insurance companies because they're not exactly sure what we do all the time. They don't pay the bill 100%, or they may deny certain treatment.
I see.
And then we have to go back in and appeal and things like that. So to answer the question, yes, there is insurance coverage for chiropractic. The best thing to do is check before you buy that insurance, that health insurance, to see if it does cover chiropractic if you want that, and how often and what is the limits that they're going to. Sometimes they limit it to 12 visits per year. Sometimes it's more. Sometimes it's less. Sometimes it's 12 visits per injury or per diagnosis.
I see.
Okay, but it's limited.
It is limited.
And they don't always pay our bill 100%.
Right.
And if you are a Medicare patient, Medicare will only pay for the chiropractic adjustment.
I see.
They don't pay for the exam. They don't pay for any of the other stuff. So, so if you're a Medicare patient, then you need to be prepared to pay out of pocket.
Yes. Oh, wow. So then I would imagine that the results often, is it more one-time results, or a lot of times you would want to see the patient for a period of time? 6 visits, 7 visits before they see.
Well, it depends on the diagnosis and depends on the severity of the either injury or the illness.
I see.
Okay. Most patients will see an immediate change. Most patients will see a change for the better within 2 visits.
I
Okay?
see.
That doesn't mean that they're finished. They just start feeling good, and that's a problem that we have. At least in my practice, what I've seen is I've had patients come see me 1 time, 2 times, and never come back. And so when we call them on the phone and say,
Yes.
"Well, why haven't you been back for your visits?"
Yes.
Well, I feel good.
Yes.
I don't feel like I need to come. So yes, it depends on the severity of it. If it's a car accident or a falling accident or something like that, we really have to take a look at the complaint of the patient, how the patient feels, and whether they're compliant in their visits to the office.
Okay. And this is another curiosity question. So I see here you have an assistant here, but also possibly your patient.
Yes.
So
Yes.
and your name again is
Billiana.
Billiana. Okay, Billiana. So then she's how old are you?
I am 16.
You're 16, okay. So then, do most chiropractors? I mean, let's say if I'm as a parent, and you have teenagers, you have young kids, and of course a lot of kids there, and a lot of sports,
Yes.
different sports, whether it be swimming, football, soccer, in high school, and like yourself, you teach in the high school.
I teach high school. Yes.
Yes, you teach. Is it okay if we mention the
Sure,
high
no
school that
problem.
you taught?
Yeah.
Yes. Dr. Lasanta teaches at Dawson High School,
Yes.
which is in Pear Lane, and I think you also teach at.
I teach at College of the Mainland in Texas City. I'm sorry, Texas City.
Okay,
Yeah, it's
wonderful.
College of the Mainland, Texas
College
City.
of
Yes.
Mainland, wonderful. So then, because I definitely for sure you will see adult patients, because
Yes,
a lot
I
of
do.
times if they're in an accident or coming back from a particular injury, let's say
Right.
they climbed the mountain
Yes.
over the weekend and then they fell and just had an accident from there. But then are teenagers or younger kids encouraged to be seen by a chiropractor?
Oh, absolutely, absolutely. Matter of fact, I am a pediatric specialist.
Oh, wow.
Okay.
I didn't know that.
Yes, I have a certification in pediatrics.
I see.
Okay, I don't have a diplomate. I'm working on my diplomate, but right now I do have a certification in pediatrics, and I've seen patients from 1 week old all the way till 90. My mother-in-law is 92, so that's the oldest person I've ever seen. So I've seen patients in between, and yes, I have treated many children. Whether they come in for injuries or whether they come in because they have a back pain, and children typically should not have back pain.
I see.
So if they're complaining about having back pain, feet pain, or headaches, things like that, that's not something that's normal in children, because they're supposed to be the healthier of all of us. So therefore, that should be a concern to the parent.
I see.
And they should really try to seek medical attention. Whether they come to a chiropractor or whether they come to, go to a medical doctor, that's up to the parent.
I see.
But they should see somebody. That's not something normal. Yeah.
I see. Okay.
So, yes, I see teenagers also.
You see,
Yeah,
yes.
I've had some teenagers. Matter of fact, I've had a teenager. I just released a 14-year-old who fractured his clavicle. Okay, and so I was doing some treatment on his clavicle, so he's better now. He actually tried out for the basketball team and made it. So.
Oh, that's great.
Yes.
Under your hands.
Under my hands, yes, under my hands.
Yeah. So, but you mentioned earlier 1 week. So a baby, you said 1 week.
The youngest that I've ever
The
seen
youngest
was
is
1
one-
week, and
Oh,
yes,
my goodness.
we have techniques. Like I said, we have to be trained.
Yes.
So I did a year postgraduate
Yes.
and got my certification in pediatrics to learn how to adjust babies.
Oh.
Okay, because although we find that the delivery, labor and delivery, and the birth of the baby is a exceptional event, but a lot of people don't understand the traumatic event that child is going through as they're going through the birth canal.
I see.
And then they actually should have an examination by a certified pediatric chiropractor. Not all chiropractors are certified to do pediatric care. So,
Yes.
yeah.
Thank you, thank you. It's unfortunate we ran out of time.
Oh,
Yes, so on the second part of the show, I will speak in Vietnamese and interpret everything that you talked
Okay,
about.
thank you.
Kính thưa quý vị, rất tiếc là chúng tôi đã hết thời giờ và thưa mời quý vị trở lại chương trình phần 2 của chương trình đây nói về chiropractic và chúng tôi sẽ dịch lại tiếng Việt Nam nhé. Vâng, thưa mời quý vị đừng có đi xa lần sống và thưa mời quý vị xem những thông tin thương mại. Thưa cảm ơn quý vị. Ladies and gentlemen, don't go away. We'll be right back after the commercials. Thank you. Một lần nữa, chúng tôi là tiến sĩ dược khoa Diana Trân và chúng tôi cảm ơn quý vị rất là nhiều đã trở lại với chương trình với chúng tôi. Đó là Sức khỏe thần thức phần 2. Và một lần nữa chúng tôi rất là hân hạnh là chúng tôi mời Dr. Renee Lasanta. Dr. Renee Lasanta, thank you so much for being here again. This is the second part of our show, and it looks like we have our patient here,
Yes.
and also our assistant. And what is your name again? Yes, this is Billiana, and so she's going to serve as our assistant and patient here. So then I would like to just go back. I know we talked about earlier in terms of the chiropractors and the years of schooling, which once again, I just want to tell you that my hat goes off now for all chiropractors. I mean, it's so much schooling and a lot of training that I think it's not very well respected in the chiropractic profession. And this, hopefully, with this, we'll influence a lot of kids out there to become future chiropractors, right? Yes. Kính thưa quý vị, chúng tôi chia sẻ là cái phần 1 đó chúng tôi nói về cái nghề mà chiropractic, thì chúng tôi cũng chia sẻ với quý vị đây là khi mà chúng ta nói về chiropractor, bác sĩ mà chuyên môn về xương đó, thì khi mà chúng ta nói về chiropractic, tiếng Việt Nam là có thể là dịch nôm na đó gọi là chiropractic. Thì khi mà một vị bệnh nhân mà đến gặp bác sĩ chiropractic đó, thì nếu mà bệnh nhân đó có insurance, cũng như là có thẻ vàng hay là có insurance thì nên là đi khám bác sĩ và cũng như là hỏi bác sĩ trước là khi mà đi sửa cái bộ xương đó hay là giúp cho giảm đau đó thì bác sĩ có cũng như là insurance có cover không? Tại vì nhiều khi insurance nó không có cover thì bệnh nhân có phải là bỏ túi tiền ra, nên rất là quan trọng là phải check với bác sĩ trước, bác sĩ mà chuyên môn về xương. Và chúng ta cũng có chia sẻ là về khi mà đi khám bác sĩ về xương đó là phải cần đi khám, có thể là không phải một lần không mà cũng có thể từ 8, 9 lần tới 10 lần, mà bác sĩ thì có thể là chuyên môn vừa đứa em bé có thể là từ 1 tuần lễ mới sinh ra, hay là có thể đến tới cụ bà, cụ ông là 70 mấy tuổi, 80 mấy tuổi, 90 mấy tuổi. Thì đây là nghề của chiropractic. So let's jump into this. Dr. Lasanta, Asian patients often have back pain. I can attest that I'm one of them. Lower back pain, especially when you sit in an area for a very long time, or maybe not enough time to exercise. And so is this treatable? I mean, because oftentimes you hear patients say, oh gosh, they have to go and get surgery, and it sounds so scary. So can you share with us?
Yes. Everybody has back pain.
Yes.
At any one time in your life, or any one time in anybody's life, 85% of adults will have back pain. Okay, children should never have back pain unless they've injured themselves or something is going on in their back. So if they're like I said in the last program, if your child is complaining about back pain, then that's a concern, and you should actually seek medical attention. Okay, it's not an emergency, but you should seek medical attention to find out what is the problem.
Yes.
Okay, because we never know what's happening in our children, and we need to take care of them. Okay. As far as Asian Americans, they do have back pain, but I found in my research and my readings that the Asians actually have the least amount of back pain compared to the rest of the ethnic groups in the world. Okay?
Wow, that's
and
surprising.
And I think one of the reasons is because most Asians are petite, they're kind of small, and they're not obese, and they don't succumb to the American diet. Okay, so I think that's one of the reasons that we have that. Back pain is treatable. As far as surgery goes, that has to be evaluated quite a bit. Okay, and I think that the best thing to do is to first try to seek conservative care, manual therapy, even before you try medication to treat the back. Okay, and there are several stretching exercises that you can do.
Oh, wow.
That to help prevent the back pain, or if you have back pain, if you feel like you get up in the morning and you say,
Yes.
"Oh, my back is hurting,"
yes.
then there are certain exercises that
Yes.
certain stretching exercises
Yes.
that you can do to kind of alleviate. A lot of that comes from being at your desk, hunched over,
Yes.
not sitting correctly.
Oh, definitely.
And so that's why we get our back pains. I
Yes.
wake up sometimes with back pain also.
Yes.
And I think that comes from standing all day lecturing.
Yes.
And sometimes when I'm treating my patients, you have to put a little force into the treating the patients.
I see.
But yes, back pain is definitely treatable in any of the ethnic groups.
I see. So then what exercise do you recommend to do to prevent some of the pain? And we can demonstrate on your patients here.
I'm going to have demonstrate on Liliana.
Yes.
One of the first things is that you see how she's laying here and she's flat. Well, she's actually putting a lot of pressure on her low back. Am I true? Is it right? Yes? Okay. So if we just bend your knees like this, that takes out a lot of the pressure because the back is curved. When you bend the knees, it flattens the back and it makes it less stressful. Okay, so when you have the knees down, that curvature in the back, gravity wants to pull it. Gravity wants to pull it. So this is a way to start your exercise every morning. Okay? And you can do this in the bed. You don't have to get on the ground, or you have to. So you can do this in the bed. So the first thing you want to do is you start either left or right. It doesn't matter. Okay. So you're going to bring this leg up. Okay. You're going to wrap your hands around the bottom. Okay. And you're going to pull slight until you feel the stretch. You're going to hold that for 10 seconds. You're going to bring it back down. Okay. The other side, same thing. You're going to pull for 10 seconds. Right. You put that down. Then you're going to bring both of them up. Okay. And you're going to hold that for 10 seconds. So each time you do that, and this is one repetition. So this is one repetition of a stretching exercise for the low back.
I see.
Okay,
Wow.
so you do this anywhere between 5 and 10 times in the morning and in the evening. Okay, and this will help stretch your back because those muscles get really tight.
Yes.
So this helps to stretch those muscles and relax the muscles.
Oh, wow.
But it's important for you to be in this position so as not to aggravate while you're doing the exercises.
Vâng, kính thưa quý vị, bác sĩ Dr. Lasanta mới chia sẻ là chúng ta khi mà chúng ta nằm thẳng đó thì cái lưng nó có thể đau hơn, nhiều hơn. Nhưng mà khi mà chúng ta sáng sớm dậy, nếu mà chúng ta ráng làm được khoảng chừng từ 5 đến 10 cái cách khác nhau thì can you demonstrate just one more time?
Sure.
And so nếu mà chúng ta có thể là sáng sớm dậy đó, chúng ta làm rất là dễ. Chúng ta lấy cái chân tay phải cong lên và chân tay trái cong lên nhẹ như vậy, hay là có thể là hai chân cong như vậy mà giữ cái như vậy, mà làm có thể là từ 10 lần, 15 lần sáng sớm, và có thể chiều tối làm maybe 3 times a day if possible.
Yes, 3
more the
times
better.
a day. If
Okay.
you're having really bad back pain,
Vâng.
then first I would go see the doctor, and I'm sure that the chiropractor is going to give you this exercises
Yes.
2 to 3 times a day,
Yeah.
and you do 10 repetitions. Okay, and that will help. The other thing that we can use for back pain is ice therapy, ice packs, and heat therapy, heat packs. And it just depends on what phase of the back pain you're in, whether you're in an acute phase or whether you're in a chronic phase, whether you use ice or whether you use heat. Okay. I want to show another
Yes,
exercise. If
please.
you want to sit up for me and face that way. Okay. So what I want to do is I want to show exercises for the neck.
Yes.
Okay, because often we have neck pain here.
Yes.
So the first thing you're going to do is you're going to bring your chin to your chest, like that, and you're going to hold that. Then you're going to come up and look all the way up, okay, and that's going to stretch the front, okay, and come back to the center. Then you're going to turn your head. That's going to rotate, okay, that's going to stretch the side that you're rotating to. Then go to the other side, rotate, hold that between 5 and 10 seconds, come back, always coming back to the center, okay. Then you're gonna try to put this ear on this shoulder. So you're gonna bend your knee, bend your neck, okay? And then you're gonna come up, and then you're gonna bend the neck the other way. So she's a little tight here going to the left.
Oh, you can
Yes,
feel that.
Yes, I can feel that. So
Wow.
if you notice how she can go this way,
Yes.
okay, and then when she goes to the left,
Yes.
she's a little tighter.
Uh-huh.
You can tell that right in here.
I see.
Okay, so she would be a candidate for an adjustment.
Oh, wow.
Okay, and then so we would do some manual therapy to relax the muscle.
Yes.
Okay, it's like a massage, but not a massage.
I
okay? Okay, we call it muscle treatment. Okay, we call it muscle treatment.
Yes.
Okay, and so we go in here. She's very tight. These muscles are very tight in here.
Oh.
And relax your shoulders. There you go. Okay, but she's still tight.
I see.
Okay, so we go in here and we do some
Yes.
myofascial release
Yes.
techniques, and we release all of the fascia, release
Uh-huh.
all the fascia in the muscle, and then we go in and adjust.
I see.
Okay, so
I
that's
see.
for the neck.
Yes.
All right. So for the mid back, what you want to do is you want to bring your your hands forward like this, just like this, okay? And you want to bend forward, okay? And then you want to round your back, like if you were a cat, bring your back up. Yes, like that.
I
Okay,
see.
and that helps the thoracic area.
I see.
Okay,
I
there you
see.
go. And you can do those. Those will definitely help prevent back pain.
I see.
Yeah.
Kính thưa quý vị, Dr. Lasana chia sẻ rằng là khi mà sáng sớm chúng ta dậy hay là trước khi tối mà đi ngủ đó, thì rất là quan trọng là quý bệnh nhân có thể là các em trẻ như vậy, teenager hay là có thể là cụ bà, cụ ông, trước khi mà đi ngủ đó thì là có thể tìm một cái ghế và ngồi như vậy, thì khi mà chúng ta cũng như là để cái tiếng Việt Nam mình gọi là cái cổ đó, làm cho cái muscle là cái bắp thịt mà ở ngoài sau cổ đây nó rất là cứng, hay là cái vai mình đây nó rất là đau, thì khi mà chúng ta exercise, chúng ta tập thể dục như vậy đó, chỉ nhẹ như vậy thôi, thì nó giúp cho cái nguyên cái cơ thể của chúng ta cũng như là vừa cái bắp thịt ở ngoài sau cổ đó hay là xương, nó làm cho cũng như là tiếng Việt Nam có thể là một lần nữa chúng tôi dịch là nôm na là cũng như làm cho dẻo vậy đó. Vâng, thì cho cái xương nó không có quá, hay là cái bắp thịt nó không có quá cứng. And what other exercise should we do, or is there anything else that you like to demonstrate?
Well, there's some other exercises that we could do. One thing that's really beneficial is when you sit on the side of the bed like this.
Yes.
You take your arms and do like this. Take your arms and then stretch forward. Okay, no, stretch forward just like that, and bend down while you're sitting on the bed.
I see.
Bend all the way down,
Uh-huh.
and that stretches your entire back before you get up from the bed.
Oh.
And then you come back and you relax. Now, when you go down, do this again, please. Go down. You want to inhale,
Inhale.
and then you want to exhale as you come back, and that stretches your upper body.
I see.
Okay.
I see.
So that's another one that you can do in the morning, and then that helps kind of help prevent some back pain.
I see. Wow, I feel good already. I do feel the pain
Okay,
relief.
good.
I can imagine that if I do this every morning, that would really make a difference.
Yes, it would make a big difference.
Yes.
It would make and we don't do it every day. As adults, we tend to live very, very fast lives,
Yes.
especially in a metropolis like Houston.
Yes.
Or any big city. We tend to be very, very fast as to
Yes.
where we're going, and we're always busy.
But-
And that's how you can see I'm really busy a lot.
Yes,
So,
very true, very
yes.
true. Bác sĩ Dr. Lasanta chia sẻ là khi mà quý vị mà sáng sớm dậy đó, thì là quý vị cứ ngồi trên cái bên cái vườn đó và khum xuống như vậy đó, khum hai cái bàn tay và thở nhẹ và khum kéo lên, thì cho cái lưng của mình nó thẳng ở ngoài sau, cũng như là mình tiếng Việt Nam mình một lần nữa gọi giống như là quý vị tưởng tượng như cái bánh vậy đó, nó cứng, thì bây giờ mình làm sao mà cho cái bánh nó dẻo ra, thì cái xương của mình hay là cái bắp thịt của mình ở ngoài sau lưng á, nó dẻo ra để cho nó đỡ đau, và mà nó có thể là giúp cho nguyên một ngày khi mà chúng ta đi bộ nó cũng đỡ đau nữa. What other exercise or anything else that you like to do? Any instruments that you like to perform?
well, yeah, okay. So I'm gonna have you turn around this other way. So a lot of times, we'll have them. Can you move your hair to the front? Okay. Sometimes I have this instrument right here.
Oh, it looks
This
like a
is-
needle.
It looks like a needle. It looks like a big needle. This is called an activator. And this is used, I'll use this mainly on elderly people because you don't want to thrust on elderly people because of the bones are brittle.
Yes.
And on very, very small children because they're small and a lot of their bones are still cartilage, or a lot of the structures are still cartilage.
Yes.
So this is one of the areas. This instrument here actually measures can deliver a thrust of 25 psi's.
Oh.
Okay, so, and I can actually put this on the exact vertebrae that I want to adjust in order for me to get some relief. Okay, so first thing I need to do before I use this is to check to see which side I have to go on. Okay, relax.
And what is
forward.
PSI?
PSI is pounds per square inch.
Oh, pounds per square
Pounds
inch.
per
I see.
relax. You know? Okay, there you go. Okay.
She's not very relaxed.
No,
huh?
she's not. She's not.
So
Okay, so I found a segment that needs to be adjusted.
Uh-huh.
Okay, and so what I'm gonna do when we do the neck, they have rings. The lower ring is for the lumbar because the lumbar spine is the largest bone.
Yes.
And then the smaller rings, all the way up to the top, is the bones of the neck because there's a smaller bone.
Yes.
Okay, and if I may, I'm gonna come around this way. And what we do, let's move here, here to the other side. So I'm gonna do that on this side. So what we do, we find a segment, okay, and her segment's right here. We place this on the actual bone itself.
Oh.
Instead of using my hand,
Yes.
okay, so we place this on the actual bone, and we thrust, and then what that does is that uses the force that's delivered from the activator to move the bone slowly back into place.
Wow. So then the patients, do they feel that when it's being pushed?
Yes, they feel a little bit when it's being pushed.
I see.
If I may use your hand.
Yes.
Okay, turn it this way. That's all they feel.
Ah.
So they feel very little,
Uh-huh.
so we don't cause a lot of damage, especially with brittle bones.
Yes.
But at the same time, the bone, the segment, the vertebrae is allowed to move back into place.
I see. Wow.
And then that relieves the pain.
Yes, yes. Kính thưa quý vị, bác sĩ Dr. Lasana chia sẻ là bác sĩ khi mà đi khám bác sĩ mà chiropractor là bác sĩ chuyên môn về xương đó, thì Dr. Lasana chia sẻ là bác sĩ xài một cái instrument là một cái cũng như là giống như cái kim vậy đó, nhưng mà thiệt ra nó không có cái kim trong đó. Bác sĩ xài để mà cũng như là bấm vô những cái cũng như là cái quyết mà ở ngoài sau cổ đó để mà cho đỡ đau. Vâng. And what other recommendations or what other? I'm sure at your office you have lots of instruments.
Yes, we have. We also use electrical stimulation. We use TENS unit, which is a transcutaneous electrical nerve stimulator when there is a nerve problem to reactivate the nerve.
Yes.
And we also use what's called EMS, electrical muscle stimulator, when we have a segment of muscle that's just not working right or it's too tight. So we do that first.
Yes.
We apply heat or ice.
Yes.
And that relaxes the muscle and allows us to do the chiropractic manipulation.
I see. I see. And also scoliosis. I think a lot of patients talk. I hear this, especially with teenager, and they're in school or even in elementary school, and the nurse would send home a piece of paper and said, "Oh, your child has scoliosis," and you're thinking, "Gosh, what does that mean? That sounds so scary. Your child has scoliosis." So what does that mean?
Scoliosis is a lateral curvature of the spine. Normally, scoliosis will start in the early childhood. Okay. And it can either be in the thoracic spine, or it can be in the lumbar spine, or you can have two curves. Okay, sometimes you'll have a right curve and a left curve. Sometimes you have a left curve and sometimes it's just in the middle.
I see.
Okay, it's a deviation of the spine, and it may be caused by a lot of different things. It may be caused from a malalignment of the spine. It may be caused because one of the vertebrae did not develop correctly, and so you have a wedge, and so that spine is just off to the side.
Yes.
But it is treatable.
Yes.
Okay. If it's caught early, then there are ways, not necessarily to correct the spine to get it back to straight, but at least to give the patient some alleviation of some pain.
Yes.
In the most severe cases, then sometimes surgery is indicated,
Right.
because it will affect the internal organs and the functions of the internal organs.
I see.
Okay.
I see. Earlier, I guess our patient and assistant here, she wasn't very relaxed. So probably because she's carrying a lot of books. A lot of teenagers carry a lot of books. So what is the proper steps do you recommend really quickly to carry your books or lifting a box?
Yes, we have this bag here.
Yes.
And the best thing to do is, first of all, you have to very quickly here.
Would you like to demonstrate?
Okay. Is we must make sure that the strap is not hanging too low. Okay, so that we can distribute the weight.
Yes.
Now this is not too heavy.
Yes.
Okay, but if you put it on one side, stand up for me.
Stand up,
Okay,
yes.
if you put it on one side, face up.
Face the
If you put it on
camera.
one side, look what happens when you put it on one side. It drags to the side,
Yes.
or you put it on the other side.
Yes.
The best thing to do with something like this
Yes.
is to go ahead and put it completely over,
Oh.
and let your entire body absorb the weight.
I see.
Because it's coming from this side and it's going across, so your body, and if you notice, she's still standing straight instead of
Yes.
leaning to one side.
Yes.
Women
yes.
have that problem. When they use the purses,
Yes.
they're too heavy, they put
Yes.
too many things
Oh,
on it.
yes.
And then they come in and they have
Yes.
a lot of back pain,
Yes.
a lot of shoulder pain.
Yes.
Okay, so, and this is one way to alleviate that.
I see.
Okay.
I see.
I see.
What about boxes? Lifting, because
Boxes?
we lift boxes
Yes.
every day,
Yes.
all day at home,
All right, so
at
I'll
work.
demonstrate lifting the box, okay? You can sit down, okay? So first thing you need to do is make sure you can lift the box. Okay, am I too close? Okay. First thing you need to do is be able to lift the box. And you need to use your leg muscles
Yes.
to lift the box.
Yes.
So you stand on either side of the box,
Yes.
and you bend, you squat,
Yes.
okay?
Okay.
And then you lift the box. You bring the box up to where you are,
Uh-huh.
okay? And then you stand up,
I see.
okay? Don't bend over, because that can cause a lot of problems
I see.
in your back. If you twist to either side, that puts an additional amount of force between 4 and 10 pounds each vertebrae.
Yes.
Okay, so, and then when you put it down, you want to put it down maybe on something that's already sturdy. You
Yes.
Put it down and you bend your legs.
Yes.
Always lift with your legs
Yes.
and with your back.
Yes, yes. Gosh, looks like we ran out of time. I'm just going to take a few seconds to interpret everything that you
Sure,
said.
thank you.
Yes. Kính thưa quý vị, bác Dr. Lasanta chia sẻ là giống như là các em khi mà mỗi ngày mà đi học mà cầm cái túi á, hay là quý phụ nữ mà cầm cái túi mà purse là cái ví của mình á, thì nếu mà chúng ta cầm nặng quá một bên bên tay trái hay là cầm nặng quá bên tay trái thì chúng ta sẽ thấy là rất là đau. Nhất là các em mà đi học đem rất là nhiều sách vở thì rất là nặng. Thành ra Dr. Lasanta chia sẻ là phải cần mang tròn qua cái lưng mà làm cho cái lưng đây nó ngắn chứ đừng có quá dài, để mà cho cái lưng của mình nó không có phải gánh nặng những cái sức nặng. Hay là khi mà chúng ta cầm lên hay là bưng lên một cái thùng như vậy, chúng ta không có nên mà khum nguyên cái mình xuống để mà đem cái thùng lên, mà chúng ta phải cũng như là phải vừa ngồi xuống vậy đó, và làm cho hai cái knee bend là hai cái góc xương ở đây cho nó đi đứng xuống như vậy, và chúng ta cầm cái thùng lên mà gần cái mình của chúng ta để mà cho nguyên cái lưng nó nặng quá mà nó làm cho đau quá. Gosh, we're running out of time.
Yes.
So if you'd like to say I really, on behalf of VAN TV, Vietnamese American Network Television, channel 55.2,
Yes.
we express our deepest appreciation,
for
Dr.
inviting
Renee
me.
Lasanta.
Thank you for inviting me.
Yes, and we're going to be running your address
Okay.
and phone number, so then if patients would like to make an appointment
Sure,
with you,
no problem.
they can do so.
Okay.
And Billiana, if you'd like to shout out to your friends at school.
I just want to say a shout out to my wife and my son, Carlo and Antonio, and to my students at Dawson High School.
Wonderful. Thank you. Thank you.
very much.
Yes.
Thank you.
Thank you, Dr.
you.
Lasanta. Appreciate your being
No
here
problem.
today. We
Thank you.
really appreciate it. Kính thưa quý vị, rất tiếc là chúng ta đã hết thời giờ rồi. Hy vọng là trong những cái lần tới nữa là chúng tôi sẽ mời Dr. Lasanta sẽ trở lại, hay là chúng tôi có thể là đến trường dạy học của Dr. Lasanta để mà phỏng vấn thêm về những cái lớp mà Dr. Lasanta dạy cho các em. Cảm ơn quý vị rất là nhiều đã theo dõi chương trình hôm nay. Đó là nói về chiropractic, là bác sĩ mà chuyên môn về khớp xương. Cảm ơn quý vị đã theo dõi chương trình và thưa chúc quý vị tràn đầy sức khỏe. Ladies and gentlemen, unfortunately we ran out of time. I hope that you will come back and join our show, which is of course aired every Saturday, and then also on Tuesday, Saturday from 7 to 8 p.m., channel 55.2, and then also on Tuesday that we have with the late shows, like kind of 1:30 in the morning. If anyone cannot sleep, they can watch us.
Yes, yes.
Cảm ơn quý vị rất nhiều. Ladies
Good
and
evening.
gentlemen, this is Diana Tran Yu with West Houston Medical Center. Thank you.